Okay, let's talk about opioids and muscle relaxants. You've probably heard of both, maybe you've even been prescribed them. But honestly, they are worlds apart in how they work and the risks they carry. Getting them mixed up isn't just a small mistake, it can have really serious, even fatal consequences. So let's just start with that. Do you know which is which? One is designed to stop a muscle from contracting when it's not supposed to. The other literally hijacks your brain's chemistry to change how you perceive pain. Knowing that one fundamental difference is absolutely the key to using them safely. And that's exactly what we're going to do right now. We're going to break down what's actually happening inside your body at a biological level when you take these meds. This isn't just interesting science, it's the critical info you need to stay safe. So let's get right into it. Okay, before we can even get into the drugs, we have to talk about the system they're designed to mess with, your central nervous system. I mean, this is your body's command center. It processes everything from the agony of a stubbed toe to the tightness of a muscle cramp. Now, the big, fancy word for any pain-controlling drug is an analgesic. But here's where it gets really important. Some analgesics, like an anti-inflammatory, they go to the site of the injury and try to fix the problem there. Opioids, they don't do that at all. They ignore the source of the pain and go straight for the command center, your brain. And that brings us to opioids. I want you to think of them less as a fix for your injury and more like a volume knob for your pain. They don't stop the pain signal from being sent from, say, your back to your brain. They just stop your brain from hearing that signal so loudly. What's really wild is that our brains are, well, they're already built for this. We have things called opioid receptors, which are like tiny, very specific keyholes. Your body even makes its own natural keys. You've heard of them, endorphins, that fit into these locks to help you manage pain and stress. So if our body has its own keys, opioid drugs are basically the master key. They are designed to fit perfectly into those same locks, especially a really important one called the mu receptor. And when that key turns in that lock, wow, it unleashes this incredibly powerful change in how you experience pain. But here's the thing, turning that key in the mu receptor is a package deal. You don't just get one thing. Yes, you get amazing pain relief, but you also get sedation, constipation, a feeling of euphoria or a high, and the most dangerous side effect of them all, respiratory depression. That means it slows your breathing down. All right, we have to clear something up here. Two words that get thrown around and mixed up all the time, dependence and addiction. They are not the same thing. Dependence is purely physical. Your body just gets used to the drug being there. Addiction is psychological. It's that craving for the high, that feeling of euphoria that the drug creates. Let's circle back to that scariest effect, slowed breathing. The clinical source material is crystal clear on this. It's always a risk with these drugs. And that risk gets way, way higher for people who are opioid naive. That just means they haven't really taken them before, or when the dose goes up. So here's the number I want you to burn into your memory, 8. If a person's breathing rate drops below 8 breaths per minute, that is a full-blown, life-threatening medical emergency. It means their body is not getting enough oxygen and you need to act immediately. All right, let's totally switch gears now. We've talked about how opioids change your perception of pain. Now let's look at muscle relaxants, which are built to solve a completely different problem, the muscle spasm itself. You know, a muscle spasm, it isn't really the muscle's fault. It's a signaling problem. It's an involuntary contraction that happens because your nerves are firing off signals when they shouldn't be. Think of it like static on a phone line, just making the muscle jump or tighten up. And this is the absolute key to understanding how they work. Muscle relaxants don't go to your cramping back muscle. Nope. They go to the command center and act like a giant dimmer switch for your whole central nervous system, just turning everything down to quiet those rogue nerve signals. And because it's a system-wide dimmer, the side effects make total sense, right? Drowsiness, sedation, dizziness, and all of that together adds up to a really high risk for falls, especially when you're getting up or changing positions. But, and this is a big but, they are not all the same. Different muscle relaxants hit different parts of the nervous system, and they come with their own very serious, very specific warnings. For example, if you stop some of them cold turkey, you could actually risk having seizures or a massive dangerous spike in your blood pressure. Okay, so what happens in that absolute worst-case scenario with opioids? What if someone's breathing does drop to that dangerous level? Well, believe it or not, there is an emergency reset button. It's called an opioid antagonist, and the one you always hear about is naloxone, which you might know as Narcan. The easiest way to think about it is as a bouncer for that opioid receptor. It has a much stronger grip on that keyhole than the opioid does, so it can literally show up and kick the opioid right out. The whole process is it's incredibly fast and dramatic. So the opioid is in the receptor, breathing is slowing down, naloxone is given, it rushes in, shoves the opioid out of the way, blocks the lock, and boom, within a minute or two, breathing is back to normal. It is a true lifesaver.
Okay, listen up, because this is probably the single most important safety warning in this entire explainer. The effects of naloxone wear off faster than the effects of most opioids. This means after the naloxone fades, the opioids that are still floating around can grab onto those receptors again, and the overdose can come back. That is why you always call 911. No exceptions.
So, we've gone through all the science. Let's wrap this up with your safety playbook. These are the non-negotiable key rules to remember to keep yourself and the people you care about safe. For opioids, these rules can literally be the difference between life and death. Number 1, never ever crush or chew an extended release pill. You could get a fatal dose all at once. Number 2, keep an eye on breathing rate. And number 3, absolutely avoid alcohol or any other depressants. They multiply the danger.
Now, for muscle relaxants, the top danger is different, but it's just as serious. The biggest risk is falling, so you've got to get up slowly. Do not drive or use any machinery. Again, avoid alcohol. And please remember, these are meant for short-term use only.
We started with a question, and now you have the answer. You know that one drug changes how you feel pain, and the other calms down a faulty nerve signal. You know the unique dangers of each one. So the final question isn't for you anymore. It's about who you share this knowledge with. Who in your life needs to hear this too?